Hi, everybody. We'll go ahead and get started now. I really want to thank you for joining. Good afternoon. Welcome to today's webinar on new data on mental health among construction workers and other CPWR resources. I'm Chris Cain, the Executive Director at CPWR, the Center for Construction Research and Training, and I'll be moderating today's webinar. In support and observation of Construction Suicide Prevention Week, as well as Suicide Prevention Month, we wanted to have a conversation about the current state of mental health in our industry and resources CPWR has developed to address it. And now I'd like to introduce our panelists. Today we are joined by Dr. Amber Trueblood, CPWR's Data Center Director, and Derek Dufoe, one of our data center research assistants. So with that, I'm going to go ahead and turn it over to you, Amber. I know you have to take a second to share your slides. Thank you so much for joining us today, Amber and Derek.
Thank you, Chris, for the great introduction and just behind the scenes for helping get everyone set up today. I know it takes a lot to get the webinar going, so I appreciate all of that. Today's webinar is intended to be just a short, quick overview of findings from our new 7th edition Construction Chartbook Interactive Data Dashboard on Mental Health Trends. We're going to start with a brief introduction of why we are interested in mental health in the industry. It's probably statistics you've heard before, definitely from my group. And then I will pass things over to Derek, who's going to highlight findings from the latest dashboard while you're here, the real reason for the whole webinar. And then we will wrap up by providing an overview of CPWR available resources. So let's go ahead and jump into some statistics. So overall, the construction industry has the second highest suicide rate among males, according to Cecil et al. And colleagues. This is the large CDC study that was recently updated in 2023. Construction had the second highest, and the manuscript before that. The rate among male construction workers was 5.4 times that of female construction workers aged 16 to 64 years old. So we see 56 versus 10.4 per 100,000 workers. In addition, males in construction had a rate nearly twice that of all industries at 1.75 times higher, 56 versus 32 per 100,000 workers. In addition, despite having a lower rate than their male counterparts in construction, females in construction did have a rate 1.3 times higher than that of females in all industries, really highlighting the high suicide burden among construction workers, both males and females, despite most of the statistics focusing on males in the industry. So I just wanted to highlight that. Our recent April 2025 data bulletin examined worker injuries, overdoses, and suicides in construction. In 2023, there were almost 16,000 overdoses and 5,000 suicide deaths among construction workers aged 16 to 64 years old. In comparison, the Census of Fatal Occupational Injuries, or CFOI, data reported 982 fatal at-work injuries among those 16 to 64 years old for the same year. Now, despite these high numbers, we did see decreases in suicides and overdoses, with a 2.7% decrease in suicides and a 6.7% decrease in overdose deaths among construction workers from 2022 to 2023. These trends highlight the need to examine and monitor mental health among construction workers. And that was really one of the driving forces for us making sure we updated our mental health data dashboard and brought it to the new 7th edition format, which includes amazing features that we think will help get these statistics out there. So I'm going to hopefully do a quick live demo So we'll now look at the National Health Interview Survey data presented on CPWR's newly launched 7th edition construction chart book data dashboard. This was launched last week for those of you paying attention to our update newsletter. Before handing things over to Derek, I do want to show you the new data dashboard if our technology works. So let's go ahead and see if we can screen share. Live demos always get dicey. So this is the layout of our new interactive chart book pages. They're very similar to the data dashboard pages, which were launched in 2021. However, they've been upgraded with a lot of features based on feedback we received. So they all have introductions, a little bit of the instructions for use with the filters, and then where to find additional information. So specifically, this is our mental health page. Derek did a phenomenal job designing this and upgrading and making sure it was user-friendly. And I'm not going to present any trends, just showing features. So if you saw, I clicked the year filter, reduced to 2018, and our text here actually updated. And so before, the pages required you to interpret charts. Understand, a lot of people don't like charts. I love them, but not everyone's me, so I respect that. So we figured out a way to actually upgrade our findings here. And so those update automatically based on the filter. And then we also have chart level filters. So that went from anxiety to depression. We have some internet issues right now, so that chart does load, I promise. Did it before this call. So that's the data dashboard at a high level. Below the data dashboard, we always tell you our data source. So if you want to backtrack or if you have questions about that, it's always provided. And we also provide definitions and chart notes for all of our data products. And this is important for mental health. Our data source actually changed definitions in 2018, so that's why we have 2 breaks on this page. And then there's the chart notes I told you about. And then for those of you that do like charts and data, we always provide our underlying data file, so you can download that, play with the data. If there's something not in the data file you're interested in, you can always reach out to us directly at datacenter@cpwr.com or either one of us directly. So those are our data dashboards, and that's the mental health one. Let me go back to sharing. Slide. So Derek is going to spend the rest of the presentation focusing on trends. However, before I hand that over to him, I just want to talk a little bit about our underlying data source and make it known that the National Health Interview Survey relies on self-reported measures of mental health, which means ultimately that individuals report their own symptoms and medication use. Self-reported data can be impacted by bias that can result in underreporting or overreporting. It depends on how comfortable an individual is to talk about mental health. It also depends on their perception of anxious feelings. So how often are you feeling anxious or depressed? And we know that by individuals, there could be variations in how you interpret that question. Despite this, the data provides good baseline information for us to monitor mental health outcomes among construction workers. And so I just want to stop here before I do start a full methodology lecture. But for anyone interested in learning more about the data, or if you have questions about how to interpret, you can always reach out again directly to our group, and we will respond to those questions and explain any data caveats that should be used. Derek is now going to talk about anxiety, depression, psychological distress, and as well as care trends identified in the National Health Interview Survey data for construction workers.
Thank you, Amber. So we'll first be looking at the prevalence of anxiety among construction workers. And we kind of define anxiety as somebody that has these anxious feelings at least once a week with a level or intensity of characterized as a lot or somewhere between a little and a lot, and or somebody who reports using medications for anxiety. And so from 2018 to 2024, the number of construction workers, I should say, that reported having anxiety went from 1.8 million to 2.3 million, and the percent increased from 12.6% to 18.4%. And you take a look at the chart here, and unfortunately, we don't have 2019 and 2022. If you're wondering why they're not there, due to the NHI, the survey not collecting industry-specific data for those years. But using the years we do have, we can see that this orange line represents the percent. And we can see that this percent is increasing for every single year this period. So we're seeing this gradual increase in the percent of construction workers with anxiety. Next slide, please. And we'll be looking at the prevalence of depression among construction workers in the same period. And we define depression in a similar format as anxiety. So we say somebody has depression if they reported having feelings of depression at least once a week, with a level or intensity characterized as a lot, or somewhere between a little and a lot, and or reported having any medications for depression. Now, from 2018 to 2024, the number of workers with depression actually decreased from 1.1 million to 999,000. However, the percent of workers increased slightly from 7.7% to 8%. And if we again take a look at the chart here, we see that the number kind of fluctuates, which are the blue bars here. The number of construction workers with depression, it fluctuates throughout this period. But if we take a look at 2021 to 2024, we're seeing an increase here. 2021 going up, 2023 going up, 2024 going up. And we look at the percent is also going up. So similar to anxiety, we're seeing this gradual increase in the prevalence of depression among construction workers. Next slide, please. And next, we'll be looking at the prevalence of psychological distress among construction workers. And we have two forms of psychological distress here. We have moderate psychological distress, and we have serious psychological distress. And from using the years we do have, from 2018 to 2024, the percent of workers with serious psychological distress decreased slightly from 2.1% to 2%. And the percent of workers with moderate psychological distress decreased about 14%. However, again, if we look from the 2021 to the 2024 period, we see that although the percent of workers with serious psychological distress kind of remained the same, about 2%, we see that there's an increase in the percent of workers with moderate psychological distress. It increased about 17%. So again, we're seeing another increase in this branch of poor mental health among construction workers. Next slide, please. And I think this is a really important chart to show because we're seeing a growing trend of construction workers that need mental health care, but they can't afford it. And so from 2018 to 2024, the number of workers that needed mental health care but couldn't afford it rose from about 294,000 to over 700,000. And the percent of workers increased from 2% to 5.6%. Now, this doesn't seem like a large percent, but in this period that we see here, this is a considerable increase. It increased from 180%. So we're seeing this increase of construction workers with poor mental health, anxiety, depression, moderate psychological distress, increasing along with the percent of construction workers that can't afford mental health care. So when we take these things into consideration, along with the rates of suicide and overdose, it's important to find and use the mental health resources in the construction industry. And I'm going to pass it back over to Amber now.
Thank you, Derek, for that great overview of recent mental health trends found in the National Health Interview Survey data, which is again presented on our data dashboard. Please feel free to hop on that page, click through the filters, and look at trends specific that you're interested in. You can also look at older data on the second tab and really see, long-term, what are we seeing in changes. So as Derek mentioned, it's really important that we address mental health among construction workers. Our data tells us that we really need to examine, especially psychological distress, anxiety, depression, and get resources out. So CPWR's data center has several recent publications that examine mental health trends, including 2 data bulletins. And I'll say we have several other data bulletins published. They're just not recent within the past year, but same page that these two are posted on. You can go back and look at longer historical trends within the industry. In addition, we have the chart book dashboard page, which was just updated last week. And that is a page that we're trying to figure out, in addition to National Health Interview Survey data, what other data sources can we supplement and expand that data dashboard to include other outcomes of mental health among construction workers. So all of our data dashboard pages are works in progress, meaning we launch and we will do updates to the data as well as the content as we are able to. So that is one of the really nice things about those data dashboard pages. In addition, we have an article, an AGIM article. I normally try to stay away from academic articles because a lot of times they're behind paywalls. Thankfully, this one is actually available on CDC's website as of now for free. So that's great. That link will download the whole PDF for you. If you have problems with that, please let me know. In addition, for this article, we have a key findings. If you're just really not that type to read a full article, you just want a high level overview. Key findings, perfect. We summarize what the article found in essentially a 1 to 2 page document. And I just want to address one of the questions that we got, since I do actually have that. So one of the questions was, are there any disparities or trends noticed among different racial and ethnic groups in the workforce? And I want to go ahead, and since we're here, mention that disparities and differences between groups are covered in a few of our resources. We did not present on that today because it wasn't super reliable in our latest NIHS data due to sample size. And so that's something we always have to evaluate, because we need a reliable sample size to be sure if the statistics we're showing. And so our 2024 data bulletin on mental health trends in the construction industry, the first one cited there, does actually have demographic breakdowns. In addition, the AGIM article I mentioned, that was the whole purpose of that article, really was to understand suicides in the construction industry and what workers have the highest risk. And so that whole article focuses specifically on answering that question. And I'll go ahead and toss it out again. If you really want us to break that down and do the presentation, we do have that capacity, just not today because it wasn't planned. You can always reach out to datacenter@cpwr.com and we'll schedule a phone call and present those specific findings to you. So I will now pass things over to Chris, who's going to highlight some really amazing resources that we have on our website.
Okay, thank you, Amber. And I see some of the questions coming in. Feel free to post them in the Q&A or the chat, and we'll get to them in just a couple of minutes. But before we do, we cannot let an opportunity go by to not share some of the free resources that we have from CPWR, largely developed through our cooperative agreement with NIOSH, that I'll go through right now. We have kind of a main landing page for mental health, and you can see the URL up there. It's cpwr.com/mental health. And then we kind of break our resources down into 2 topics, suicides and opioids. The mental health resilience training is available through our website. And this is a free training program that folks can download and deliver on their job sites or in their training centers, which is a discussion-based training with 9 different modules that really is intended to help people through kind of experiential learning and motivational interviewing, the issues around that are affecting construction workers. And I urge you to go take a look at that and see what you think of it and use whatever parts of it you might like. Likewise, we have a free awareness training that's focused more on opioids, and these 2 issues are completely linked. We have a crisis in both sides of this issue, mental health, and including death by suicide and death by overdose. To raise awareness about opioids and particularly the use of prescribed opioids. We have slideshows available. We have a facilitator's guide and participant handouts that make up this awareness training program. Again, free for use. Download it and use it as you will. The last thing on this particular slide, and to remind folks, we are sending these slides out with all clickable links on them, in addition to what Jess has thrown in the chat as we go along. We were able to fund 5 research projects related to trying to prevent suicides and overdoses. And those research papers are available on our website for anybody to download and look through. Next slide, please. I'll talk a little bit more about those 5 research projects in a moment, but other resources we have that we ask you to go use are a series of worker aimed material. We have both on suicides and preventing overdose, hazard alert cards, which we can send to you in the mail for free as small folding up cards. I don't have one right in front of me, but I wish I did. Yes, I do. These are the types of cards we have for free on a lot of different topics that you can order from us. Just give us a call or look on our website for ordering forms, including on suicide prevention. But we also have toolbox talks in both English, and all of our hazard alerts are English and Spanish, particularly on our website. Most of our printed ones are in English, though we do have some in Spanish. But also on our website is our series of toolbox talks. These are, again, available in English and Spanish, developed in a format that is supposed to be the best format for learning, based on NIOSH research. And please download those. In the center of the screen, you have an example of one of our infographics. And this one, you can see our logo and the logo for the Construction Industry Alliance for Suicide Prevention. We partnered on a number of print materials. And then all the way to the right is another resource I would like folks to download. I ask you to. It's called the Physician's Alert, and this one is related to opioid use. It's intended to help construction workers speak to their doctors about occupational related pain, and when they speak to their doctors, how to request medicines for pain that don't include opioids. And we call this a really great example of an intervention that happens before any kind of dependency could ever form from medicines, by trying to avoid medicines. So one way that we think will save a lot of lives. Next slide. We have done, this is our 4th webinar related to suicide prevention this year. And I think probably close to our 9th or 10th one overall. Just last month, we partnered with the Construction Industry Alliance for Suicide Prevention to discuss one of their new publications, which we've co-branded with them, talking about suicide in construction, and we have that on our website as well. It gives guidelines not to, to every level. It's talking to peers, it's talking to employees, and it's even talking to the media, or how the media should talk about suicide. And it's really about what type of language to use and why that language is important to choose properly. The 2 webinars that are 2nd and 3rd on this slide are 2 that highlight the results of those 5 research projects I talked about that we were able to fund. Each of the groups that had conducted a research project presented on that project in those 2 webinars you have in March and June in 2025. So I suggest you can go back and look, and then there's some additional ones that one at the bottom in 2024, and next slide lists a whole bunch of webinars we've done in 2024, 2023, back to 2020, looking at these issues. So these are all available for viewing free, and the links will be in what you get mailed, or the slides that are available that Jess has already posted. And there's a couple more slides, just one more slide. This is a request for y'all. If you can you believe I'm from New York and I said y'all? I've been in Maryland a long time. This is a newsletter we put out about 4 times a year, and it's really intended to try to shed some positive light on developments that are happening around trying to address the issues of overdose and suicide in our industry. So each episode or each newsletter, we try to highlight some good actions and activities that are being undertaken, as well as resources and research and that type of thing. But you can sign up for that newsletter right there through our website. So we would love it if you would. And with that, we're going to go to Q&As. So I've seen some of the chat come in. Thank you. With that, Amber, you answered that first question we had on disparities among different racial and ethnic groups. And the next question I had for you is about, question is, have studies been conducted to learn how many construction workers were also vets deployed into combat zones? And just go for it.
So there are studies that are starting to look at veteran status among construction workers and mental health outcomes. John Davis, specifically, who presented on one of the webinars Chris just brought up, highlighting his project examining the impact of employment laws on construction workers' suicide. He used NVDRS data, so a slightly different data source, which has veteran status that's yes served or no served. And that's most of the time our surveillance data is limited to yes, they served, no, they didn't serve, without actual information on deployment. John did control for veteran status in all of his models and all of his work. So that's something I would highly recommend you check out. That report's at cpwr.com. Jess might be able to track it down and pop that link in there. But it's been widely talked about. And then in addition, CDC does have data, the same data source that Derek just presented on. That is a research data file that we're exploring as a future data source to examine. We've had to kind of postpone that a little bit because the ability to get federal data sources, the process is changing under everything. And so that is one that we have flagged, because that would actually allow us to get more information besides just yes or no served. And so that is on our radar. And then in addition, if you get on the literature, there are a ton of like focus group interview based with smaller sample sizes where they are trying to specifically answer that question. And if you need those references, I'd be happy to share some that I've found doing literature searches.
Thank you, Amber. I appreciate that. I want to go to something I just saw in the Q&A. And Jess, am I able to share my screen? Oh, yeah, I am. So the questions were more like statements. And I think they're really, really valid. There's lots of causes to feelings of despair or feelings of discontent among construction workers. And this person is asking or stating, you know, being home, away from home, I mean, being a traveler, working 10 plus hours a day. I would add to that lack of sleep, and being away from your family and typical support systems. It's not just about access to a trained psychologist. And I just wanted to absolutely agree with this sentiment and kind of share one slide that I like to share a lot when I talk about these issues. And this is from a review paper. This is reproduced an image from a review paper, and I really like the way it lays out the risk. The data we're providing is new data based on available data sources. So we show kind of incidents across the industry, but we don't have data sources that really get at all of these different types of risks that contribute to suicide or suicide ideation or suicide behavior. And a lot of those in the upper left-hand bubble are related to the job site. And I think that's a really important point, because when you talk about work-life conflicts, you talk about workplace harassment and bullying, production pressure, which is related to another question we got about low bid contracting. These things related specifically and more, physical injury and chronic pain, are related to suicide. these things are absolutely imperative to recognize and also control. And that's, thinking about what we can do in our industry. How can we change our job sites, our work conditions in order to eliminate the precursors to these development of diseases of despair? And we can't fix everything on this slide is another consideration that we always have to think about. But what we can affect, we should, and that's largely in the upper left-hand bubble, and to another extent in that lower left-hand bubble. I think there's a lot of things we can do in our industry to address these risk factors. So I wanted just to share that because I thought it was really important to talk about how this person who asked this question is 100% correct. And there are a lot of issues that we're not presenting on today and we can't necessarily measure that are super important when we think about suicide prevention. Okay, I'm going to ask Jess too if you have any answers to some of these questions that I've noted from our um, Q&A to jump in and join in the answers. Jess, if you know, is not just our person who helps us run all of our webinars. She's also our research to practice director. She runs a whole arm of our organization. Plus, she's a board member for the Construction Industry Alliance to Prevent Suicide. So she's definitely an expert at that. With that, I would like to, maybe get your reaction to a kind of a set of these questions. So construction workers tend not to ask for help. Are there resources to address this? And also, how do you get construction workers to open up about mental health issues? And kind of like what is the approach that could be taken on the job site or as an employer to start to talk about um, mental health issues?
I have two thoughts on this. Thanks, Chris. One, I think the more you talk about it and just, force your coworkers to have those conversations or at least to listen to a presentation, I think the more the stigma gets reduced. So, the first time somebody hears about suicide prevention and hears that you're open to helping them, they might ignore it. They might say that's not relevant to me. They may even reject talking about it. But if you just slowly incorporate more and more discussions around mental health, then I think people get used to it and they're more willing to talk about it as time goes on. I think the other thing that we have found with construction workers is that a lot of them are willing to step up and be the helper more than they might be willing to ask for help. And so I think when you frame it that way to say, talk to your crew members, get to know them better. If you notice that somebody is acting differently, ask if they're okay. The more you encourage them to engage with their coworkers and be a friend and be the helper, then I think that breaks down some barriers as well. The more they talk amongst themselves about it and the more they try to help their coworkers, the more likely they will be down the road to seek help if they need it. So I think really it's just a lot of conversation and meeting people where they're at, keeping it light at first if you need to, and getting the buy-in over time.
Thanks, Jess. There's a couple questions that kind of point to this, and I know this might put Amber or Derek on the spot because it's data that they've produced before. You showed the information that your team produced about the number of deaths each year by suicide, opioids, and on the job traumatic injury. So it was, I like to call it like 1,000 on the job traumatic injuries. We had 5,000 construction worker suicides and 17,000 overdoses. And that's the 2022-2023 data. It's very similar. How does that relate to on the job incidents related to suicides, overdoses? Do you have that at your fingertips? Because I was just thinking really hard about this yesterday. I happen to have it if you don't.
Yeah. So chart 10 in our April 2025 data bulletin, ironically, I cut that slide because I thought it would get too far into the weeds. And we really want to focus on National Health Interview Survey today. But yes, we did look at it. And what we found in 2023, there were 100 at-work overdoses. So we know there were about 17,000 overdoses reported among our construction workers 16 to 64 years old. 100 of those were flagged as occurring at work. And you can start seeing those in publicly available OSHA data and their narratives. They'll say overdose and describe it a little bit. And then as far as our suicides, 38 of our 5,000 suicides occurred at work. Now, I want to, again, get into the data weeds just briefly. We're not sure how reliable that actual number is. We know that there's about 1,100 at-work fatalities in CFOI. When we pull at work in the National Vital Statistics System, there's about 850. So we do know it's not a full census. It doesn't align with CFOI. And that's because mortality data, it is based on source documents. And if it's not screaming at work, it does not get flagged properly. So that's likely an underreport. But out of the total, it's a small percent, even with that underreporting.
Great.
Derek, do you want to add anything?
I don't have anything to add to that. I think, Amber, you nailed that exactly.
So, and Amber, that's in the construction industry, right? That's not across all industries.
That is correct.
So somewhere in the 150 range between the two, between overdoses and suicides on the job in 2023. I wrote down 138 or 147. I don't know which one is right. Or about right.
Yeah, so it's around 140. I would have to stratify. You have suicides that are and overdoses, and this is covered again in our method section in that report. So we look at overdoses and we look at suicides, but there is a small overlap actually between definitions. So I would estimate around 140.
Thanks. And so I think, one of the questions that I've been asked a number of times is, why is this an issue for our people who are involved in occupational safety and health? And I think that's the issue, right? I mean, we've got well over 100 of these events that normally happen off the job that are happening on the job. And it's masking, I believe, the progress that we're making in addressing a lot of other hazards. We talk about the focus for in construction and the 2023 numbers, we had over 400 falls, we had over 150 struck bys, but we had well under 100 electrocution, or I think it caught in between each, well under 100, but we've seen in the neighborhood of 150 deaths by suicide and overdose on the job. So I think that answers it right there. This is a prevalent problem on our job sites as compared to other traumatic deaths, and that we need to think about what we can do with the workplace and how to address it. Some of the questions come around OSHA, and one of the questions I see asked is about OSHA training. The question is part of the OSHA training now including that we speak on mental health? If so, how much would we speak on? I think that when you talk about OSHA training, you can be talking about a lot of things that are required by standard or program, and there are no standards about discussing mental health on job sites. There is now a requirement to use a mandatory handout in OSHA 10 and 30-hour classes related to mental health. We could try to dig up the link to that and put it in the chat, but there's not any through the OSHA Training Institute outreach program. There is not any curricula associated with that handout. So it makes it kind of hard for instructors who are just safety and health instructors to talk about the issue. I think that's where the resources we have come in, and that we've flagged in the PowerPoint slides, how to talk about issues related to suicide, mental health, and overdose might be helpful for outreach instructors dealing or trying to figure out how to use that handout that OSHA mandates be used in the training. Another question that came in was about OSHA rulemaking. What is it anticipated that there would be OSHA rulemaking? Based on my experience working very closely with OSHA rulemaking for almost the entirety of my career, no, I don't think there's a chance that we're going to see any regulatory action on this at all. And I can go into detail with people if you want on the phone, call me. Who is this person? With the strong connection to pain and the increased use of opioids, suicide, and declines in mental health, has there been any research or intention to research the link between prevention of MSDs, ergonomics, and the increase in pain-related risks? We have research on that. We have research, and I don't know how much it is at your fingertips, Amber, that we can pop on to the chat. But we have research to show that workers with MSDs have a higher incidence of taking prescribed opioids. Is there anything is there any sneak peek in your next data bulletin that would help that question, Amber and Derek?
On our next data bulletin, no, but there are several studies that Sue Dong, our former data center director, did as like her very last focus target area before she retired. It was actually one of her like really big, she wanted all of the statistics out. So I'll pop those links in there. If for some reason the meeting ends before I get them in there, you can always reach out to me, or also get them to Jess, who can include them when she emails you with follow-up information. And then that's also something our team is working on updating now that we have some newer data. And the other thing that did come up in the questions is the impact of the COVID-19 pandemic on mental health and what that actually looked like. And so all of these studies were done pre-pandemic, so we'd like to redo them post-pandemic and account for any pandemic increases we saw. And then just as a general note, so I can answer that question fully, World Health Organization estimates that there was a 25% increase globally of depression and anxiety. US had a slightly lower percent increase if you look at national trends. And that for the US construction industry was published in a data bulletin, I believe 2021, and that is on our website. And I'll pop that link in the chat as well. So I answered a few questions at once, Chris.
But no, I appreciate that. And I'm trying to sift through the questions while not listening to you. So I might ask you the same one again. A lot of them we've already addressed in different ways. If you can. What one is more of a request, and I don't know if we can fulfill it right now, but you know, there's a lot of employers who are addressing this with model programs. We know of a few national organizations as well as local organizations who have provided these types of programs for everybody to use, and they're in the public domain. And they're really kind of blueprints for employers to follow. And I think that if we can't find any of those resources right now, I think that we will provide them in the follow-up email. But there are toolkits out there from start to finish that some employer groups are advocating that seem really good to me. You'll just bear with me for a minute. Okay, training. In addition to the resources that we've talked about that we have for free on the website, I think, did Jess you post something on mental health first aid? Um, that that's one
Okay.
training program we've heard about that's really excellent. What is the one that's offered for free through CIASP?
That's the Living Works, the shorter option of the Living Works training. They have a short like a 2 hour or 90-minute one, and then they have a full day one. That's a great initial training. Vital Cog is a great work related one. QPR, question, persuade, refer.
Great. And there's also someone on here that's flagging AFSP, the American Foundation for Suicide Prevention, is working on this issue and has just launched hardhatcourage.com, which includes information on how a person can get to their training program for the construction industry called Talk Saves Lives Construction Program. The Hard Hat Courage is where to get links to how to get yourself in there, and Jess has got it posted already. Um, Fantastic. I'm going to check. There's 12 questions that haven't been answered yet, so give me a moment. I'm going to take a look in there. I wonder, there's been a couple questioners, Amber and Derek, who've suggested that some of the increases in reporting of anxiety or other mental health stressors, or the ability to talk about it has been increasing recently because of the difference between younger and older workers. I don't know if any of the information or data that you have available would suggest that that's true, other than I think common sense suggesting that it's true.
Yeah, so Derek can hop on because he did go through all of the methodology and that in great detail. Overall, the National Health Interview Survey, there's not really a way to say like, are you know, more perceptive to reporting? And we could try to control by age. The problem then becomes reliability of data by breaking it out to try to control for that. But yes, when I was talking about self-reported data and it being underreported or underreported, a lot of that is based on someone's personal comfortability of talking about mental health. And we do know in general, and there are older studies that say like younger generations are more likely to talk about sensitive topics in general. And that's where like drug use, mental health would fall into. Derek, did National Health Interview Survey directly address that?
No, they did not. But it that's a great question because you see these rises in these recent years, and you would think, is it is it because there's more young people joining into construction? But the survey just really doesn't provide any info for that. You can break it down by age, but you would really need a good sample size to really determine that. But it's a great question to really dig into.
I think another question that you have already dug into, I don't know if you have the information available to share at the moment, but the question is, do you have fatality data broken down by trade?
The workplace, yes, and then suicide overdoses. We have some breakdowns, but we then again also run into very similar sample size issues. If there's a specific trade you're looking for, let me know and I can look at the reliability of that data.
Did you have
And
something in the paper you uh that
yeah,
William had
so the
last?
suicide one did, and iron workers had the highest rate. That was of again, and that's in the article. I'm trying to avoid method rants. But yeah, we had a lot of sample size concerns, and so it was just select occupations that were really reliable that we believed the findings to be accurate for that group. Because we don't want to go based on two workers and a trade saying something, because that may not be actually representative.
Great, thank you, Amber. And then I'm gonna articulate the next question. I don't think we have the answer for it right here, but just to flag it for follow-up, Jess, is there specific information about the amount of suicides among injured workers available, and can you share that information there? That is considered a risk factor from that meta-analysis image that I showed, which is out in the peer-reviewed literature. So we'll take a look for that literature and try to provide it in follow-up. And with that, I'm gonna wrap it up. I know there's a few other questions in there that I'm not sure, we have the answers to, or we haven't been able quite to I haven't been able quite to interpret that we have had the answers to. But I did want to go ahead and wrap up here and thank very much our data center and our incredible team of analysts, Amber and Derek, for sharing on today's webinar, as well as thank Jess and our translators, as usual, for helping us present this information. I hope everyone, uses the rest of this week to continue to observe and talk about and just share resources. Is probably the easiest way we can destigmatize. Thank you all so much.